Hello everyone. This week I want to talk about home confinement, increased testing, and movement. We continue to review for placement in home confinement at the direction of the Attorney General and have approved over 2,400, an 86% increase as of March 26th. Many of our stakeholders in the media believe that we should be releasing a larger number of inmates. Increasing the number of releases on home confinement is challenging for a variety of factors. For example, many inmates are ruled out based on their current or prior criminal conduct, specifically those with histories of violence or sexual offenses. Some inmates were denied early release because they were involved in serious misconduct while behind bars. In other cases, inmates do not have COVID risk factors warranting early release to the community confinement. And finally, many inmates simply lack an adequate release plan for home confinement. The BOP is not seeking to replace a judgment of a sentencing judge or criminal jury. That is not our role. In making decisions about community confinement, the BOP will continue to balance public health and public safety, as these factors will remain priority considerations when reviewing cases for home confinement. On May 8th, we provided updated guidance on home confinement to all locations to ensure we increase consideration for home confinement without greatly increasing the risk to the public. Most notably, when reviewing an inmate for potential community placement, inmates who have received a 300 or 400 series incident report may now be considered for placement on home confinement at the discretion of the warden, assuming they otherwise satisfy previously described factors. Home confinement is generally prioritized to those inmates who have served a certain portion of their sentence or who have a relatively short amount of time remaining on their sentence. Currently, we are prioritizing those inmates who have either served 50% or more of their sentence or have 18 months or less after having served 25% or more of their sentence. As the current situation progresses, these thresholds and additional criteria may be adjusted. I also want to talk about testing, which is a major focus both internal and external to the agency. While we continue to provide testing for symptomatic inmates as recommended by the CDC, we have also expanded testing of inmates utilizing the Abbott ID Now instrument for rapid RNA testing at select facilities, thanks to the support and assistance provided by the Attorney General and the Department of Justice. In late March, a call with Attorney General Barr resulted in coordination between FEMA, HHS, and the BOP in order to increase testing capabilities within the BOP. The Attorney General's direct support allowed us to secure additional machines and test kits as their availability increased, and has enabled us to significantly enhance our response. We anticipate acquiring 50 additional Abbott ID Now instruments and testing kits, which will double our current inventory. Once these resources arrive, we plan to expand testing at all detention locations, including high-rise facilities and jail detention units in standard facilities, as well as at all identified quarantine sites, in order to test every inmate arriving at those facilities. The Health Services Division will disseminate guidance regarding testing procedures for these detention and quarantine sites in accordance with CDC recommendations. Using the Abbott instruments requires planning and resources. Testing takes 15 minutes per sample, 4 tests per hour, and requires 2 personnel to administer these tests. We're leveraging existing comprehensive medical contracts to obtain additional medical personnel for testing where such services are available. As a critical part of the Bureau's plan to mitigate the transmission of COVID, we have decreased internal movement by 90%. This action, along with quarantining new arrivals, were bold and important short-term steps to ensure we were appropriately identifying, to the greatest extent possible, inmates requiring isolation and quarantine. But going forward, in order to alleviate population pressures in detention centers, we must resume limited movement of newly committed inmates. As I have noted in the past, the federal judiciary continues to process criminal cases. Since ceasing most movement, there have been 6,800 new initial commitments into the BOP and another 7,000 inmates pending regular transfers to their designated facilities. The BOP must move these inmates to a designated facility for service of their sentence. The BOP will work with the United States Marshal Service and carefully coordinate how to transport and transfer these inmates into BOP custody while taking proactive steps, including testing, to mitigate the transmission of COVID into our environment. Inmates will not be moved until they have first been tested, and documentation of negative test results will be appended to their movement file. The movement will be deliberative and gradual and will be focused at the following sites: FCC Victorville, FTC Oklahoma City, and FCC Yazoo City. Testing will also be performed for new commitments from arresting federal agencies into BOP detention facilities. As a result of increased testing, we have seen increased numbers of positive inmates, many of whom are actually asymptomatic. There are now more than 2,818 inmates with current confirmed positive results. The number of inmates that have recovered is 1,288 and climbing, and this is very encouraging news. Staff recoveries also continue to climb, with more than 279 staff recovered. Please keep the 262 staff who currently have confirmed positive results in your thoughts and prayers. Stay healthy and be safe. Exercise CDC best practices and serve as a role model to inmates so that they mimic these best practices as well. Continue working together as a team to overcome this unprecedented challenge and accomplish our mission. Positive thinking will enable you to better complete tasks than negative thinking will. Together we are stronger. Together we are making the difference. Thank you.